My name is Pureza NG. I'm in Bowman's Adult Health 1 class. I'm going to do a short video on insertion and irrigation of a nasogastric tube. Nasogastric tube. So I have my equipment here. I have the nasogastric tube, which would normally come in a package. She would open. I have the lubrication. I have the sterile water over here. Sterile or tap water can be used actually. You want to use lukewarm. Not too hot, not too cold. Now, in order to measure the tube, we're going to take the tip of the tube to the nares over the ear, down to the xiphoid process. Once we've measured our tube, we're going to put I got my tape pre-cut. So I'm going to take the tapes. I'm going to mark my tubing with the length of insertion. So this says it's at 65 centimeters. Okay. So I've marked my tubing. I'm going to check the Peyton's nares. See if I see any deviated septum. I would ask my patient if he has any allergies to medication, to any issues. I'd ask 2 patient identifiers, name, date of birth, check the patient's wristband, compare it to the MAR, confirm that nasogastric was ordered for the patient, and the purpose of it, whether it's for suction, whether it's for tube feeding. We want to know the reason behind the order. After we've done that, I'm going to ask the patient to hold each side of his nair and blow out air, and we're going to see which side is more forceful, which will probably be a little bit helpful indication of which side is wider or larger per se. I'm going to take the tip of the tube. Once we've done all that, we've already marked our tubing. I'm doing hand hygiene, so I wash my hands, put my gloves on. I'm going to ask for my assistant to come in with me right now, and he's going to bring in the water in a straw, and we'll be using that during the procedure, so the patient can swallow water as we advance our tube. Not yet. So we're going to take the loop, and we're going to move up our tube, the end of the tube. We're going to ask the patient to lean his head all the way back. For the beginning, we're going to place our towel or napkins over the patient. We're having to use napkins because we don't have a towel right now. Normally it would be a towel. So the patient's head is in back position. We're going to go into the left nair. Now this time we're going to take milk in, and we're going to go in and towards the ear and insert slightly, and then we're going to ask the patient, everything okay? We're going to ask him to bring his chin down towards his chest, and then we're going to give him some water, and as he swallows, we're going to advance the tube. Okay. And this is done slowly, not to hurt your patient, give him time. If there is coughing or seems to be a problem, we're going to stop fluids, and then I'm going to open up and look in the oral cavity and make sure there's no coiling of the tube in the back. If there's not, we're going to continue with the procedure. Okay.
That's a good looking hair. That's the hair. Where does it beautiful. Beautiful hair.
On a real patient, you want to let them know what's going on every step of the way. As they talk and respond, it's another good sign that it's not coiling, it's going in where it should. If they're not able to talk, you want to pull out your tube and try a reinsertion. Check the back of the throat for any coiling. Now, once we've gotten to the place where we have marked off our tape, okay, we're gonna ask the client, ask the patient to talk to us. So is everything okay? If he responds, no problem, then we know that we've got a good placement. Okay? Again, we're going to inspect the pharynx, make sure there's no coiled tubing. Now, if this is for suction, I'm going to attach it to low intermittent suction. And then I'm going to check for the clarity, consistency, and the color of the fluids. Okay. Right now it's not an order for that, so I'm going to actually aspirate the contents.
Okay, I see you in a minute. Oh. I might stop by my house. Or I might go home. Hi guys. Bye. Are you going or are you not? She wants me to go home.
Okay.
I'm sure I probably.
So we've gotten contents. It's not coffee grounds, it's not bloody.
I feel bad if she's in need.
So I'm going to test the pH. If that's your hospital's policy, you might want to test the pH. We're going to re-inject the aspiration that you withdrew, noting how much stays in, or if it all goes in. I'm going to place stethoscope over the abdomen to make sure that I hear it going back in.
So don't drink. I probably won't drink. Then I'm the one going to bed.
Okay, I'm going to hear a swishing sound.
Homegirl thinks that we're going on freaking wild days. I didn't even tell her that she's going to bed. She knows that headache. I told her.
Okay. Now I'm going to anchor my tube to the nose.
That is the problem. Maybe.
And I'm going to make sure that I'm still at 65 centimeters. I'm going to make sure that your tubing has not moved.
I think it's both. I haven't eaten anything until I took it. Chicken. Yeah. Two little chicken. You need food. We'll go. We'll eat. Okay. No drink.
I don't have any of my meds on me. But if you want, you can follow me home.
I don't think I'd make it back.
You would take it first.
I'll see you there.
Are we ready?
And a bobby pin. I'm going to bobby pin this to the patient's gown to make sure that it doesn't move.
Put you back on. Alright, I'm ready. Are you comfortable, Mr. Bob? Picture time. You're comfortable? Okay. You need anything before I leave? Okay, hello. My name is Emily Messick, and I'm going to I would much rather do it in front of like a million instructors.
Bobby pin that in to secure that it doesn't move. Okay. Now, if we're not going to attach the end to suction cup, if it is for a feeding or such, then we're going to basically do a slip knot at the end of our tube to secure it. And make sure that we tie that off so there's no dripping or mess all over the bed. Okay. Okay. Now for my documentation, I'm going to put the date, the time. It's at 65 centimeters at this time for my tubing. I'm going to check my client's response to the procedure, make sure that he's doing okay, that he's not too uncomfortable, that there's no bleeding from the nose. There may be a little blood tinged at first, and that's normal, just from mucosa irritation. That's not uncommon, but you don't want, obviously, pools of blood coming out from your nostril. Okay, you're going to double check that the end of your tube is fastened with a rubber band. It is clipped to the patient's gown to make sure that it does not come out to secure placement. And make sure that
You should have like a shirt.
we have the tube
Wait, I don't have
taped up here.
I'm like, so good for this.
After we've done that,
Just leave this. Okay.
like I said, we're gonna make sure we've labeled it with the time, with our initials, the date, and the centimeters of the insertion site. Okay, and the client's response to treatment, we're gonna document all of those things into the mark. Okay, we're gonna keep the patient in a high semi-foul,
Oh,
just while we irrigate. Okay, now I'm gonna throw away my gloves, do hand hygiene, wash them again, get another set of clean gloves. Implement your standard protocol, keeping the position in a high Fowlers. If it's for suction purposes, I would disconnect my tube from the low intermittent suction.
Which arm is your, which arm is your dominant hand? My left hand. Your left hand. I'm gonna use your right hand today.
I'm gonna withdraw
Before we begin going back, what is your name and then your date of birth?
30 mLs.
Thank you. Do you have any allergies?
By aspiration.
Can you tell me if you have any surgeries like mastectomy on that side? Okay, thank you very much. I'm going to look at your hand to
Again, you're gonna make sure you have a towel or something covering the patient.
Yours are hard. You can try it. Yeah, I'm going to apply the term. You know that right here? I mean, that's
You try it once.
I'm gonna push the gastric contact back in. I'm gonna take my tap water or saline solution, drop 30 mL, and we're gonna flush the water.
Love you faces. So you guys Wednesday,
So we're gonna aspirate a little bit,
mine are good too.
and while listening, we're gonna inject 30 mL and document that fluid as intake.
Are you guys all coming out too?
After that, we're gonna disconnect our heater, and we're gonna tie off the tip with our rubber band. And that's the end of the irrigation of the nasogastric tube.
Have all my information, the water's right next to me, there's a second room right next to me as well.
Okay.
We're good?
And that's the end of the video.
Pain right there.